Welcome to All Things Chiropractic.
Well, welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
And I am Dr. Mark Davini. Welcome.
So today we're talking about the chiropractic dilemma.
Do we have a dilemma?
Dun, dun, dun.
Do we have a dilemma?
I don't know, doctor, you tell me. You've seen chiropractic for a long time in your career.
We do have a dilemma. And I can say there's many ways to voice this, and even in previous podcasts, we've expressed other ways of saying it. But let's just kind of focus this down a little bit for this podcast. It's really, our dilemma is that we don't have a consistency of our messaging.
Would you say that consistency includes things like how we define subluxation, how we adjust, how we educate patients? Like,
there's no two of us the same. And that's nice in that we have that individuality in our practices, but I'm coming from the perspective of the patient, that now that chiropractic is so widely accepted, and we are widely accepted, patients talk about us. They talk about us to their friends and to their relatives, and they will also be going to chiropractors, and then they start comparing notes, and all of a sudden they realize very few notes can be compared.
Or read. That's a different podcast. So here's a pop quiz for you, Doc. If you had 100 chiropractors checking 100 patients, what's the percentage of patients that would actually need an adjustment?
Let me think about that. All of them.
100%.
All of them. 100%. So, most of the time anyway, we would say, most chiropractors would say, I can find something to adjust.
So from an optics standpoint, as a layperson, I'm not a chiropractor, as a patient or potential patient, it kind of plays back into that whole Gallup poll statistic about the ethics and trustworthiness of medical providers, and chiropractors were among those specialties listed. Do you think that this lack of understanding from a layperson's perspective, like, to me, I would say, well, how is it you go to a doctor and 100% of doctors tell 100 patients they all need adjustments? Like, aren't you for neck and back pain? Aren't you for getting me better? Why do I need an adjustment if I have nothing to complain about?
Well, exactly the dilemma. And to make it even worse, they probably have other healthcare professionals saying, no, you don't need that. Or no, that's not true. So the problem is...
Or you're going to get hurt if you go there.
Or you're going to get hurt if you go there. So we have outside sources that are conflicting with our message, which is fine. That's life. Nobody agrees with everybody 100% of the time. That's what we've been, I'll say, resisting for so many years. And certainly chiropractic has grown, so our resistance has proven to be effective. But I'm talking about the lack of consistency throughout the chiropractic profession. Between all of us, inter-chiropractic consistency.
So it's interesting because if we look at that, because, a lot of our audience are chiropractors, so they're coming from their perception, not the patient's perspective, perhaps. But there's not that many colleges in the country that teach chiropractic. So one would wonder why there's so much diversity in the education, in the technique, in the analysis of subluxation, things like that.
Well, again, going back to the foundation of chiropractic, that we are science and art and a philosophy, every school has their own percentage of each that they sort of ascribe to. So some schools might be more focused on the science. Others may be heavily focused on the art, the techniques of what we do, and others may be heavily focused on the philosophy, and then others may be equal percentages of all three or whatever. So even throughout all the schools in chiropractic, there's no consistent teaching of what it is that we do, why we do it, and how we do it.
But for me as a layperson, here's the rub. If I go in and I have appendicitis, and I go to probably a GP and then certainly a surgeon, they're all going to find that I have appendicitis. They might find
Correct.
other things, but that's not none of your business. But what I'm saying is, like, when I go to 100 DCs, they will likely all find subluxations, but they will not find them in the same area, level, side.
And there's the problem.
Right? I didn't know this when I first started chiropractic. I got adjusted from my Palmer grad boss, and he adjusted me, and then I got adjusted by his associate, a Palmer grad, and I'm like, this was completely different. Like, there was nothing the same about it. And over the years, as I got adjusted by people, even yourself, like, the approaches can be completely different.
Totally. And that is our problem, because the entity that we call a subluxation obviously has some problems, has identity issues, okay? In that what we say is a subluxation in broad strokes may be present, but nothing specific enough to say exactly what you just said. If I put a bunch of chiropractors in a room, I have them examine me, we're going to find a bunch of different findings. They're going to come out with a bunch of different levels of subluxation. They're going to decide to adjust them in a bunch of different ways. And here's the thing. Oh my God, it all works.
But so I want to know this question then. And I'm going to flub the technical clinical part of it, because again, I'm not a chiropractor. But let's say you palpate me and you're finding a subluxation C2 right side. Is that possible? Does that make sense?
Yes, it does.
All right. And then another chiropractor palpates me, doesn't find C2 right, he finds C4 left, but he or she doesn't find C2 right. Who's correct? All right, that's it, folks. Thank you.
Well, if you were to ask me,
Yeah.
since in my opinion, I was the best and the best chiropractor there is out there, I would be right and they would be wrong. Now, there's the dilemma.
Right.
I should never say that.
Right.
I am not right over another chiropractor. I am right for what I do and how I do it. But wouldn't it be nice if we were all taught similarly enough to arrive at similarly enough outcomes and findings? But it's not working that way, because there are those that in the earlier days, there were very specific named techniques. Remember, the Gunstead and the Thompson and the
Atlas orthogonal. And
Atlas orthogonal. And,
Yeah.
and some of them are still around and still being taught. But a lot of times now, a lot of schools only teach, I'll say, gross, diversified manipulation techniques. So manipulation and adjustments, in my mind, are not the same thing. But yet, this manipulation, mobilization, I'll say non-specific types of adjustments, or at least non-specific rationales. I can't tell you how many chiropractors I've gone to and said, will you adjust me? And the first question out of their mouth would be, well, where's it hurt? And I've said this, why does that matter? Just adjust my subluxations. Hopefully it will get rid of what hurts, but adjust my subluxations. And without having a consistency in our techniques and our approach, our exam procedures, which is what all of those name techniques attempted to do, we have this dilemma. I mean, let's face it, there are two main techniques out there that have the exact same finding that conclude totally different things. One of them, you have a short right leg that goes long on flexion. Generally speaking, one technique says that's a PI right ilium, and another technique says that's a body right L5.
Who's right? I'll stop asking that question.
It could make for a very long podcast. So what we're trying to do is point out the dilemma, and at least an approach to living with it and dealing with it in our own worlds.
It seems to me that, in general, chiropractors are trained to adjust to reduce vertebral subluxations and, extremities too, let's say. But non-chiropractors, perhaps if they're quote unquote adjusting, let's say joint mobilization, it's really about joint movement, not reducing a subluxation.
And here we go to the heart of the dilemma in my mind. Excuse me. You have findings that determine what a subluxation is in your mind. They can be different. So for the sake of argument, let's just pick 3. that there is a joint restriction, there's hypertonicity of associated muscles, and maybe even some specific local tenderness. Those would be my 3 criterion for adjusting. Great. But yet, if the patient is acute and they have extreme pain, they're going to still have those 3 findings if I'm going to adjust that segment. If they're a maintenance patient, they should have those same findings because I still have to have a reason to adjust and a reason not to adjust. So in my mind, a maintenance patient will be someone that has those 3 findings on a trace level. That's maintenance. If they were acute or had pain or whatever, anything above trace puts them in the active treatment phase in my mind. So that gives me a criteria. I don't care what your 3, 4, 5, 10 things are to determine what to adjust. But what I'm saying is if I only have 2 of those 3, it's not a subluxation in my mind. And you have to be that way. You have to know when to adjust, which is very important, and when not to adjust. And this is personal. We're not going to come to a consensus on what are the things that we all should be looking for. So it brings us to this dilemma about saying, well, we know patients need to be adjusted. We know patients will need to be adjusted on a regular basis. That's great. What I'm saying is you need to decide in your mind when and when not to adjust, and then how to adjust so that at least your message is clear and consistent throughout your practice. And then we can expand it to the broader scope of consistency throughout the profession. Try and find those commonalities that every technique has and start focusing on those commonalities so that we can develop an approach to chiropractic that is consistent, predictable, and repeatable.
Wouldn't that start at really the college level? I mean, the colleges collaborate on this concept so that even though they're all competing for students, they're unified in what chiropractic as a profession is and what chiropractors as a profession do.
Exactly. It really all comes down to the schools. And this consistency and repeatability has to be not just within their own school system and their own school approach to chiropractic, but they have to collaborate with other schools and start finding our commonalities because they have to be out there. We do what we do and people get well, and we all do what we do differently and people get well. There has to be something. What's the commonality here? Because it's certainly not, a short leg that goes shorter on flexion, or hypomobility of a joint, or, my posture tilts this way and that way, so I'm going to do this and that. All of those approaches do get people well. So what's the commonality that makes all of these techniques work? We're not.
Well, that's the rub, right? Because if you're a school that embraces philosophy before art and science, your rationale, even if the art and science is similar, but your rationale for it is going to be different from a school that embraces the science first, the art second, and philosophy, if at all, is lean. How do you get these? How do you herd these cats?
Well, that's what we're talking about, and we certainly don't have the full answer here. We're just kind of pointing.
You don't have any answers. I keep asking.
I know this is the dilemma.
I got another dilemma for you. Right? You ready for this one?
Oh, wait a minute. Imagine those same schools. Some are completely mechanistic in their approach to chiropractic, and some are completely holistic, or we'll say vitalistic in their approach to chiropractic. So, who's right?
Good question.
And nobody has that answer right now. So somewhere out there is this commonality between, or a mix, or the right combination of vitalistic versus mechanistic versus technique. And all of that would be where we need to move so that in the future we start becoming a consistent profession of chiropractic. It's what made medicine so successful.
And I have to say, for those chiropractors out there, you've got a patient or someone that you think would make a great chiropractor and a student, know their personality so you can help them find the school that they're going to feel they should be going to rather than a school that might not, align with their personal views about healthcare and the approach of chiropractic, even if they're not a chiropractor yet, because I can catalog in my mind after all these years the schools that I would resonate with more than others, depending on
Oh,
how you approach.
absolutely. I mean, some of them, I'll be kind. Some of them I wouldn't send anybody to, and others I would strongly endorse sending people to, so that we know that when they come out. But what am I saying?
But wait a minute. If there's someone who's completely opposite you on approach, wouldn't they go to maybe perhaps they belong at the school you wouldn't send somebody to because their approach is completely different?
That's what I'm saying, that all of these people are going to graduate and perpetuate the dilemma.
Ooh. Look at you tying it all in.
Yeah.
All right. So I have another question that this is like the question that chiropractors ask. First, I'll set the stage by saying, is a listing a subluxation? When you do a listing, is that the same as identifying the subluxation?
It's identifying the misalignment components of the subluxation.
So is a listing an assessment or a plan?
It's technically the plan that was concluded by the exam. So I did an examination of the patient, say I motion palpate. I did an examination of the patient and I motioned the segment and I determined that there's a fixation in this direction, in that direction, in that direction, in that direction. So how do I report that? I report it by a listing, but the listing is representative of what my clinical findings were.
For example, the assessment is your ICD-10 codes.
Correct.
Right?
Yep.
Doctors, you hear that?
Yeah.
And your listings, hopefully you have specific listings, not the cervical region was adjusted.
Yeah. I mean, let's get, this is what I mean.
I don't want to digress too much. But.
No, but that was perfect because here's the discrepancies we have out there. Some people will say, yeah, I adjusted the cervicals. Which ones? C3, C4, C5, C6, and C7. Well, those aren't really adjustments, are they? Those are manipulations. You mobilize those areas for a specific reason. But what is your definition of subluxation? If your definition of subluxation is such that you can incorporate all those segments as part of your adjustive technique, then that's on you. That's good. So, but what we get is, I adjusted the cervicals, like what you said, or adjusted the thoracics. I mean, documentation requires the level and truly the side, at least if you're going to talk listings, at least say C7 on the right, and then have a technical
that one word can bail you out. So many times.
Many times. Right.
All right. So another sort of, we'll talk about patient perception and I'm not going to say myths, but common observations about chiropractors. Once I go, they're going to tell me I have to go forever.
Correct. And this is the message that hopefully your office is able to communicate effectively, because subluxations happen. And there's just no two ways about that. Life, everything you did to create that subluxation in the first place, you will do again. So it's like, what do we say? It's teeth cleaning. You don't go and get
That's the best
cleaning.
way, I think, to equate it is you go to the dentist at least every 6 months for cleaning. At least that's the recommendation.
Right.
And
they're going to find stuff.
Right.
Tartar on your teeth or whatever,
Right. You don't eat once in your life and stop because I'm satiated. You have to eat again.
You don't get one haircut forever.
Yeah.
Well, there were times it looked that way with you, but
I know.
But you only get one. You don't get one haircut in your lifetime. You don't shave just once. I mean, our whole life is cyclic, and so are subluxations, unless we change our habits and most likely adapt new habits that will create new subluxations. But for the most part, our lives are cyclic, and it's that cycle that forces us to end up with subluxations, a lot of times even in the same areas. Depends on how young we were when we first got to a chiropractor and how long those subluxations were present before you finally ended up seeing a chiropractor and having them handled as best that they can be handled at that time. But yes, you will come back. So
does it come down, like, to me, I think if I'm a patient going to a chiropractor, maybe I know a little bit about chiropractic, I start to know more, hopefully. The education that I'm getting every time I come in, to me, if I'm coming in for pain and it's a pain clinic, okay, we've talked about this, right? Then it's catch and release. But the opportunities every time I come in there to understand more and more of how and what is happening from a chiropractic standpoint. Like, how important and how well do you think chiropractors handle patient education today?
Well, I think that's an individual thing. And although we can't solve all of the problems of this dilemma right now, one of the problems we can solve is the message. We can get more consistent with what we say to people. So even though my technique may be different and maybe I'll still find different levels to adjust and whatever, I may incorporate certain procedures that others don't, whatever. But what we can say is to a patient is a message that is the same throughout the profession. So if we were to get into this closing thought thinking, on a topic that obviously we have no true solution for, but we do have a direction in my mind. It's very simple. Let's stop eating our young.
Boy,
Okay.
Good luck with that.
Yeah, very seriously. We need to praise chiropractic, period. Praise it. All of us. Chiropractic is great and wonderful, and it does things for people that nothing else can do, number one. So number two, we have to praise all chiropractors. Praise all chiropractors. Now, some of that may be that we say less about one than another, but chiropractors are chiropractors. Adjustments work. The worst chiropractor in your town still is getting sick people well. So we don't put anybody down. Chiropractic is wonderful. People who practice chiropractic are wonderful. And then you praise yourself if you want to make people understand that you are the best chiropractor in your mind, which I hope you think that way. Otherwise, why would you take patients and not? I would send them to the best one I know if I could. So praise the profession. Praise the individuals and praise yourself.
Can I tell you an area where that doesn't happen very often?
Go.
Independent medical exams and record reviews.
Oh,
when you've got a chiropractor from across the country, Monday morning quarterbacking what you did as a doctor, and all the things we just talked about, the diversity of approach and care, how can they actually?
They can't, because there is no consistency, and everybody keeps looking for the standard, but the standard is not clearly defined in our profession, and that's what we're talking about moving toward. We can start that by, again, praising the profession, coming up with a consistent message that we all, in one form or another, put out there. Praise chiropractors with at least that all chiropractors practice a profession that is something that everybody needs. And then we can praise ourselves as far as our business ends of things. And I think we'll get there eventually.
Good food for thought.
Good food for thought. What, you're talking about eating your young again?
Yeah, right. Yeah. They're tasty. I can't stop.
Okay.
Anyway.
With that closing thought.
Yeah. Thank you again for listening to another episode of All Things Chiropractic. I'm Paul Andrews.
And I'm Dr. Mark Davini.
Please listen again.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.